Hi, this is Cynthia for FMP 597, SOAP note number 3. The patient initial is JM, and he is 66 years old. He is a Caucasian male here to the clinic today. He's a good historian, and he comes by himself. His chief complaint is shortness of breath and swelling in the lower legs for the last month. His HPI, JM, is a 66-year-old Caucasian male who comes to the clinic today complaining of dyspnea and bilateral lower extremity edema for 1 month. He describes the shortness of breath that occurs with minimum exertion, such as walking short distances or climbing steps. The patient reports that his ankles swell throughout the day. In the evening time, his shoes really feel tight. He denies any weight gain over the last month, and his associated symptoms is fatigue, decreased exercise intolerance, occasional dry cough, and he denies any chest pain or heart palpitations, fever, or any other type of recent illness. He does have a past history of CHF and hypertension, no hospitalization. His medications, lisinopril 10 milligrams once a day, metoprolol 50 milligrams once a day. He's on Lasix 20 milligrams once a day, no over-the-counters, no allergies. He's up to date with his immunization. Family history is positive for father is deceased at age 72 with heart attack, and his mother has a history of hypertension. He is a retired mechanic, and he does still work part-time, so he stands on his feet a lot, and he feels as if maybe that is causing his swelling. But he says that he follows a low sodium diet. He exercises once a week when he feels well enough. He is a smoker of 30 pack a year history. He denies alcohol and caffeine. He denies any sleep disturbances. He does have family support. His review of system, he complains of feeling tired. He has gained 5 pounds over the last month. He denies any fever or chills. He does have a S3 heart sounds. His lungs are clear, no congestion, and he denies his wheezing, coughing up bloody sputum, but he does complain of the shortness of breath. GI, GU, and neuro are negative for any abnormalities. His blood pressure is elevated, 142 over 90. His saturations is 94. We did a chest x-ray on him, and it did review that he had some pulmonary congestion. We did a BNP on him, and it was 680. A comprehensive BNP seems to be normal. His creatinine is 1.2. His GFR is 68. Glucose was 95. His CBC was unremarkable. Physical exam, he seems to be well nourished, but he does look a little tired. With the cardiac exam, he does have the S3 heart sounds and some decreased, diminished breath sounds. His respiratory rate is 22. He doesn't use his accessory muscles. Abdomen, no organ megaly. Lower extremities, he do have the pitting edema in both extremities plus 2. He's alert and orient ×3. And so our diagnosis is CHF. His weight gain, his BNP is elevated some, and he does have a S3 Gallop. A differential diagnosis would be pneumonia, pulmonary embolus, and COPD. The plan is for echo to continue to monitor his electrolytes and his kidney functions, increases Lasix to 40 milligrams, continue his regular medication, restrict the sodium, elevate his legs, elevate his head, 30 degrees at nighttime, follow up with cardiology, and come back for a return visit in 1 week. Thank you.